Are you one of those people who experience skin itching or even a rash immediately after exposure to water, for example after bathing? We call this aquagenic pruritus. Basically, it is an allergic reaction that involves itching of the skin immediately after exposure to water, regardless of the temperature of the water or its source. There are variants of the illness like cholinergic urticaria, which will occur after exposure to either very cold or very hot water, and then there's cold urticaria, which will occur after exposure to very cold water. Usually, the symptoms will start within a few minutes, around 10 minutes of exposure to the water, and they will last anywhere between 1 to 2 hours, after which they will usually subside on their own. Now, the illness can range from a simple pruritus, where you have a few isolated rashes or itching that usually do not disturb the person so much, to a more severe form of the illness, where you have a generalized body itching or rash, and in most cases, this one will discourage people from bathing. In most cases, when you have severe disease with all this generalized rash I've talked about, there could be an underlying blood problem. Most cases, you'll find a condition we call polycythemia rubra vera, where someone's blood is very, very thick because the bone marrow is making so many blood cells. At this point in time, science is not yet certain what exactly causes this condition. Some people think that the water will wash away some essential oils from the skin, which triggers the allergic reaction. But there are some cases where we have seen it as a manifestation of a psychological disease, for example, depression, anxiety. And after these conditions are treated, aquagenic pruritus also goes. So treatment. Now, the first line will be the simple medication like antihistamines like cetirizine, mast cell stabilizers like montelukast, and steroids like hydrocortisone. Secondly, there are some creams that you can apply. There is a CeraVe anti-itch cream that you can use, applying it a few minutes after showering, or there are other anti-pruritus creams. I came across one that contains camphor, menthol, and calamine, and reports say that it is very good for this condition. Then thirdly, they recommend baking soda, sodium bicarbonate. You can add it a little bit to the water before you shower, and it has also been proven to reduce on these symptoms. Then number 4, if you have been showering using rainwater, you should stop that and use tap water instead. These two water sources will have different mineral composition, and the composition in rainwater has been shown to increase the incidence of aquagenic pruritus. Then number 5, in very severe disease, this drug naltrexone that we usually use for people who are trying to stop alcohol or other opioid addictions, it has also been shown to help in this condition. And lastly, you should go get checked for blood disorders in case you're having very severe disease.